you can get started.
Hi, sorry about that. Forgot to unmute myself. Thank you all for joining us today. I hope you are all safe and warm wherever you are. My name is Karen Ben-Moshe, and I'm the Policy Program Officer at Blue Shield of California Foundation. Blue Shield of California Foundation supports lasting and equitable solutions to make California the healthiest state and end domestic violence. Within that dual mission, we work to strengthen economic security and mobility for Californians. We know that a person's income and wealth, especially when viewed through the lens of racial and gender equity, are powerful long-term contributors to health and well-being. Communities of color and people with low incomes, women and immigrants face extra barriers to achieving economic stability and mobility, and we're committed to addressing the root causes of those inequities and removing those barriers. One of these is access to income and benefits, such as paid leave. When workers and families have access to paid leave, it allows them to take time off to spend with a loved one who is sick, a new baby, or an elderly family member without going into debt. And paid leave addresses both parts of the Foundation's mission, including our work to end domestic violence. For example, according to the CDC, research suggests that access to paid maternity leave may be protective against intimate partner violence, in addition to helping women maintain employment and reduce stress. When we started thinking about the idea of a webinar on paid leave, it became clear that we couldn't focus only on legislation, but that we needed to also address implementation. If we only focus on passing laws and not what comes after, then there's a risk that legislation will be enacted in a way that creates inequities in access and use. And the way that we design policies and programs matters. We need to make sure that programs are designed and legislation passed that encourages and allows for the broadest access possible. Today, we're going to focus on how we can design policies that advance equitable access to paid leave for families with low incomes and communities of color. We're going to have a follow-up webinar that I hope you will join, which will focus on implementation. I'm so excited about our speakers for today, who bring such a depth of experience to any discussion of paid leave in the US. First, to make sure we're all on the same page, we'll have Marianne Bellasorti providing a brief overview of paid family and medical leave in the US. Marianne is a graduate of the Kennedy School of Government and is currently the Director of Programs and Advocacy at Family Values at Work. Her career includes successful advocacy for paid sick and safe days, fair work week, pay equity, and rights for domestic workers. Then Jody Hyman will share exciting new research looking at the design of state leave policies and what states can do to encourage equity and access. Jody is founding director of the World Policy Analysis Center, distinguished professor at UCLA, and author of over 500 publications. Jody shared that when she began working on paid leave in the US and globally 3 decades ago, she never imagined her granddaughter would be born into a country that is only one of 6 countries in the world to still lack paid leave for all. Finally, we'll end with Jenya Cassidy, who will share about the great work that has been happening here in California and how data supports their ongoing advocacy efforts. Jenya is the director of the California Work and Family Coalition, the statewide alliance of community organizations, unions, nonprofits, and individuals dedicated to winning and implementing policies that help California parents, caregivers, and communities thrive. After they speak, we're hoping to have about 10 minutes for questions. Just a couple of quick logistics. The webinar is being recorded. The recording and any materials from the webinar will be emailed to all registrants within 1 week of the webinar. And please use the Q&A feature to ask questions throughout the webinar, and we'll collect those for the end or answer them throughout as it makes sense. Thank you again for being here. And with that, I will turn it over to Marianne.
Thank you so much, everyone. Thank you for having me today. My name is Marianne Bellasorti, and I am the Director of Programs and Advocacy at Family Values at Work. Family Values at Work is a movement network of grassroots organizers and coalitions in more than 24 states, and we're working towards economic, racial, and gender justice. Our grassroots movement is powered by the leadership of those most impacted and includes peer learning and collaboration. Our coalitions have brought together more than 2,000 diverse partner organizations and together helped over 60 million workers gain access to paid sick and safe days and paid family and medical leave. So, of course, these issues are incredibly important to us and to everyone in our network. And we wanted to start out today by discussing a little bit more what those two terms mean. So up here on the slide, you'll see a few different families dealing with some of the different things that happen to everyone. And the first thing I want to talk to you about quickly is paid sick and safe days, which is hours or days that are just short amounts of time to care for yourself or for a loved one, to get access to medical care, including preventative care and mental health care. The safe days part of this equation would be to access help related to domestic violence and assault. And it can be used for medical needs, but also a range of other things such as finding housing, speaking to a lawyer, or attending to other items that might need to happen during someone's working hours. Parental leave is the next piece that you might hear about, and this is sometimes referred to as maternity or paternity leave. And it is what it sounds like. It's leave available to parents, but it's only there for a limited time. Parents can usually just use it for childbirth and bonding. It may be up to the first year after a child is born, adopted, or brought in through foster care. The leave isn't available if the child becomes ill or needs caretaking after that first year. What we're going to talk about today is family and medical leave, which is long-term care for yourself and for a loved one. Many of you might be familiar with the FMLA, which offers unpaid leave to workers in very specific circumstances, depending on the size of the business you work for, how long you've been there, even which family member you want to take care of. The paid family and medical leave that we will be talking about today usually has much more coverage, and it's paid, which is incredibly important. So with paid family and medical leave, we've all had moments in our lives, either planned or unplanned, where we need to give or receive care. People get pregnant, they have children, there are cancer diagnoses, there are slips on the ice that result in broken bones and in time away from work. There are all times when we need to be able to rest and recover and possibly have some help from our loved ones. In addition to just the immediate, having someone to care for you or having time to recover for yourself, paid family and medical leave creates incredible intended consequences by allowing families, it strengthens a family's ability to breastfeed and bond with their child. It improves infant brain development. Paid family medical leave can ensure that seniors are able to stay in their home and continue living independently even after a health scare or a health crisis. And with all of the great things that paid family and medical leave can do, you would think that maybe we would see it in more states. However, we are thrilled with the states that we do see it in, and so glad to talk to you right now about all of the different things that paid leave can do. So you'll see up on this map here, the states in dark blue have all passed paid family medical leave laws that are now in effect. California's law is over 20 years old. Oregon's law just started accepting applications, so we have a big variation. You also see some states in kind of a bluish green color that have passed paid family medical leave laws that will be coming online in the next few years. And then finally, you'll see some states in yellow that are still using statewide temporary disability insurance, which has been in effect in those states for a number of years. So all this being said, I am thrilled to turn this over to Jody to take us on to the next step. Thank you.
Thank you so much, Marianne. It's great to be here with everyone, and great thanks to Blue Shield who made this possible, and Family Values at Work, and California Work and Family Coalition, who have partnered with us on this work. So thrilled with everybody who's joining us, and I'm going to dive right in. What we did was ask the question, how much have states solved the equity problem? So the United States is a total outlier, as you heard in the beginning in my introduction. Nearly everywhere in the world guarantees paid leave to everyone. As I think everybody joining knows, the United States paid leave to everyone in terms of mothers and overwhelmingly for sick leave as well. The United States, one of the few places where it's left up to states. The good news is every state that has taken a step forward has narrowed that equity gap. But the question is, by how much? So what did we do? So we looked at each state's policies. Who did they really cover? Who don't they cover? Those small rules that may seem small, how many hours you have to work, how big your employer is, how long you have to have worked for them. But those details matter in terms of whether everyone's covered. And we want to answer the question, is everybody covered equitably? Who's left out by gender, by race, ethnicity, by income group? And then take a deep dive in one state, in this case, California, to see how we could improve equity. But I'm going to show you results across all states, give some suggestions for how we could make things better in California, and then also use California as an example for people who are concerned about increasing equity in other states, about how we could do a similar deep dive in other states. So I want to go ahead and start with what are the big findings for medical leave. As you heard, there's parental leave, family medical leave, and personal medical leave. I'll give you an early finding that the gaps across race, across gender, across jobs, categories, and class that we saw are very similar across all three. So the slides I'm going to show you will just do this for medical leave, and we're happy to share the others, but it's the exact same pattern for parental leave and family medical. So first, eligibility. Who's left out by the eligibility rules? The big story is if you have a high school education, you're much more likely to be left out. And if you're a woman, you're more likely to be left out. So this goes, we went on, and I'm sorry for the distraction. This is a perfect family moment. I do caregiving not only for a grandchild, but for an elderly parent, and that was my elderly parent calling. Inequities in who is eligible. Again, in this case, you're seeing a graph around, do you get paid leave when you're sick yourself? But this would look the same if we were showing it to you for a family member who was sick or for parental leave. I'm going to take a minute on each of these. You can see in every state, the blue bar is higher. So that blue bar is less than a high school degree. The red bar is next highest. These are the people who are most likely to be ineligible. So often the people who need the paid leave the most because they have lower earnings are less likely to be eligible for the leave. That's true, as you can see, across basically every state. So what drives those gaps? Well, the piece that drives those gaps is, again, these detailed rules. Minimum tenure or weeks you have to have worked makes those gaps bigger in Delaware, in Hawaii, in New York. Minimum work hours makes the inequities greater in Delaware, Hawaii, Maryland, and Washington. And then you can see listed here the states where minimum earnings make those gaps greater. For gender, it's about work hours and earnings. So women earn less and they're less likely to qualify because of that, even though they're more likely to be the ones providing the leave. When it comes to affordability, there are big inequities across racial and ethnic groups. So here we have affordability of the leave, and so you have access to it and you can afford to take it. And you can see the two groups, the green Latinx workers, the red Black workers, across the states, those two groups are the most likely not to be able to afford to take the leave. Here too, people who have less than a high school degree or only a high school degree or GED, the blue and the red, more likely not to be able to afford to take leave. We looked at affordability by a poverty measure. The half the median income, that is often used as a poverty measure instead of using the federal poverty line. And the reason we use that is, as everybody knows, some states are just a lot more expensive to live in. So again, I think what it's important to see is, so have these states done something good? Yes. In all of these states, it's more affordable than in states that passed nothing, because if they passed nothing, it was unpaid leave. We know that unpaid leave lands people who are in low wage work in poverty. So while these states are doing better, some people are effectively covered. Consistently, there are still important gaps. So what's driving those gaps, those affordability gaps? It's really two things. One, we could and should do better on wage replacement rates. And second, there is the baseline disparity from historic and persistent discrimination in income wealth across racial groups. I do want to mention here specifically to California. California had really important success in increasing the wage replacement rates. We still see challenges in California, though, if someone needs 12 weeks of leave or a longer leave because it's for 8 weeks. So they might be combining a well-compensated 8-week leave with unpaid leave. A piece that is important not to forget is no one can afford to take the leave unless they're both guaranteed the leave, it pays enough that they can financially afford it, and they know they have a job to come back to. Because states have had to fill in this gap, this lack of federal progress in a piecemeal way, often passing one law at a time, the job protection is often in separate laws across states. Now, here too, there are inequalities. Women are less likely to be eligible for job protection than men. Workers with less education are more often excluded, and Latinx are more often excluded. So by now, you'll, I think, be familiar with these graphs, but I think it's worth spending some time on them still. The highest bars, the most people who lack job protection are, once again, people with less than a high school degree. That is true in every single state that has a minimum firm size requirement. That means, say you work for a small company who only employs 10 or 5 or 20, you're more likely to lack the job protection. Minimum hours also, though, disproportionately leave out people with a high school degree or less, because they're more often working in jobs that may be precarious, where they may need to change jobs, get new jobs, and not have enough hours in that same job to get job protection. We see that as well with the minimum tenure requirement. Have people worked long enough? So the people who are in the most vulnerable work, whose jobs are changing over, are more likely not to be able to take leave because of fear of losing their jobs. Now, we've talked about the fact that women are more often caregivers. I'm showing you the medical leave, but as I mentioned, this pattern is the same for family medical and for parental leave. And yet, women are more likely not to have job protection because of the hours requirement. And they're more likely to lack it. Their women here are in green because of the minimum tenure requirement. Finally, there are racial disparities in job protection. The group that's left out the most consistently are Latinx. You're seeing me circle them. They're the highest bar, this green bar, in every state: Delaware, DC, Hawaii, New Jersey, New York, Rhode Island, Washington. When there's a minimum firm size, that's because Latinx workers are more likely to work for small employers than other groups. So the big picture findings are, again, every state that's passed this has made income more affordable. They've made it more affordable because we have no pay at the federal level. On job protection, still, they haven't fully closed that gap for women or for workers with less formal education. On job protection, some of the states rely on the federal FMLA, so job protection looks the same. Others have passed a little more, but still there are real disparities. And while the income has helped with affordability, we still have gaps. So let's take a state that's made tremendous progress, as California has, and look at, can we do something about these gaps? Can we take the states that have passed something and do more? What does that show us? Also, for states who might newly be passing paid leave, what are some of the issues they should consider? We have 3 main recommendations for California, and I know when she speaks soon, Jenya Cassidy will add a broader view around California, but I want to focus on 3 in the areas we've discussed. The biggest is expanding eligibility for job protection. So if California had the same criteria for job protection as it did for receiving income during paid leave, 5.2 million more workers would have access to job protected leave. So that would be an enormous win. The biggest reason for that is that job protection in California still requires a minimum of 1 year on the job. That excludes nearly 4.3 million workers. And it disproportionately excludes workers who have less education. The second big reason is the hours requirement for job protection. So California requires 1,250 hours in the past year. That excludes, you can see, nearly 3 million workers from job protection. Again, an enormous number. Compared to the federal government, California has shrunk the firm size, covering more workers. It still leaves out 1.5 million, but that's better than these other measures. So what's recommendation number two? Recommendation number two is around the duration of leave. And we say that because in California, the leave for non-birth parents who don't, birth parents draw on both medical leave and a family caregiving leave under parental leave. But non-birth parents just get that caregiving leave. It's 8 weeks. You can see it's relatively short compared, it's the yellow, compared to most of the states that have passed paid leave, with the exception of a few are guaranteeing 12. Finally, making sure that job protection and income both cover all family members. You can see here the designations. The job protection is quite broad to include anybody the equivalent of a family relationship. The income is also broad, but not as broad. Why would we care about that? We care about that because we live in a state where many people have family out of state, out of the country. If they need someone to care for them or to care for their neighbors, it may well not be one of these immediate blood relations. And you can see from this map that there are a number of states that have progressed to this broader family definition, both broader than the federal government and broader than California. So I want to end by talking for a minute about next steps and where this goes from here. I realize I've presented a lot of data in a short amount of time, so I want to be sure to keep it short so that we have plenty of time for questions and answers and discussion and hearing from all of you. But I also want to make sure to invite everybody to be back in touch with us directly, particularly around two things. If you come from another state, or if you're working on a national level and you say, okay, well, those are 3 good options for California. You can tell us really concretely for California, but what would be the concrete steps for other states? Reach out to us. We would like to talk through what does it take to really narrow those gaps for other states that have the same pattern of improved paid leave, but not yet covering everybody. If you're from a state that's thinking about passing it and you just want to have a deeper discussion about what do we have to worry about in the details, again, please reach out. We also want to partner, whether it's here in California, in working towards these evidence-based improvements that can cover everyone, or in other states. We're grateful. These are examples of some wonderful infographics that Sandy Davis developed together with Blue Shield. We're grateful for everybody who's helped with resources, but we do have lots of online and shareable resources and are happy to partner. I wanted to make sure to put up, and we will share after the webinar, some contact information. Nick Perry heads our outreach and partnerships. Alita Sprague, who's joining me here today, can talk with you about what a deep dive in another state or on another social policy issue examining the inequities could look like. And Allison Earle also here has really led these rigorous analyses using census data. So we look forward to the chance to talk more with you about all of these. And I'm glad to have gotten us back on time. I'm gonna pass it over to Jenya Cassidy from the California Work and Family Coalition, who will help us now think more deeply about California. Thanks again for joining us.
Yay. Thanks, Judy, and thanks, everyone. I'm really happy to be here talking about this. This is a great, really great webinar to think about how data like what the UCLA World Policy Analysis Center is doing and how it impacts our work and helps us design the best leave policies we can. So I'm Jenya with the California Work and Family Coalition. Next slide. So we're a statewide alliance. We're a longstanding coalition, and we're a statewide alliance of organizations united in the belief that all people should have the time and resources to care for themselves and care for their families. And we work on changing this situation because, as we know, the US is way behind other countries. So in California, we do this through organizing, advocacy, and education. Next slide. So the coalition started, we came together back in 2002 to launch our first campaign. And in the first year that we came together, we passed paid family leave. And it was a big deal at the time because it was the first in the nation. And even though we were hearing predictions that it would take 10 years to keep introducing it and keep getting people used to the idea, since it just wasn't a thing in the United States yet. We only had unpaid leave since 1993. We got together to work on this, but it was really based, even at the time, on a lot of work in this field and a lot of research and education. For example, we knew we wanted to do this. We did learn and think about what are the best ways in California, what are the structures like our state disability insurance that could really, where we could establish a paid family leave law. And the other piece of data that we were collecting is field work, really hearing from workers by doing some trainings up and down the state and hearing from workers how FMLA really wasn't working and people did need paid leave. So next slide. And when we passed paid family leave in California, it really sparked a national movement. Family Values at Work came together or started a year later, I think 2003. And it's been really great to have this national network that we're a part of, partly because we never really wanted just one state or a handful of states to have paid leave. The whole idea is about how we really want a federal law. We really want nobody left out. And part of how we do that is by having the most inclusive laws we can state by state. And Family Values at Work has been really supportive of all of our different states in the network, having a really good ground game, building coalition, which is very important to us, and also standing firm in really wanting to have the most inclusive laws possible, even if it takes time, and it does take time. Next slide. So early on in the beginning, after we passed paid leave, the first study that came out that really impacted our work was Eileen Applebaum, labor economist, and Ruth Milkman, a sociologist, wrote a study, Leaves That Pay, or they did some research, and it showed that paid family leave in California had an incredibly positive impact on the people who took it. More dads were bonding, parents were doubling their bonding time. There was an increase in the median duration of breastfeeding doubled, and it was just contributing to the overall health and well-being of parents and families, including economic security, which we've learned, from we have such a diverse membership. And one of the things we've learned working with Blue Shield and the Partnership to End Domestic Violence is that this impacts so much more than what you would think. It really even has an impact on incidents of domestic violence. You really, having economic security just impacts families in so many ways. So it's kind of a crucial part of our work. So we learned this, and this was great because we really need this if we're going to keep, working on improving our law. Next slide. And the same study, though, it also showed the other side of this, which is a little bit of what Jody touched on. Really, not everybody was benefiting equally when we first passed paid leave. And I didn't mention, but when we first passed it, it was only 6 weeks, and there were a little bit of differences in it at that time. But we learned that it was really not impacting certain workers. There was very low awareness among low-income, new immigrant, Latino, and young workers, much less likely to even be aware of the program, but also when and if they were aware and went to take it, there were barriers that people found that prevented a lot of these exact same categories of workers from taking leave. And that was that low awareness is obviously a big problem, but the others were having fear of termination or job loss or retaliation, and then having very low pay. So that, if you have low pay, 55% of your income which is the amount at the time, would not be enough. This really impacted us. Next slide. This had a profound impact on our work because it changed our focus to increasing awareness and access through policy and education work among those specific groups. Next slide. So our theory of change, our working theory of change, is that we really will get stronger inclusive laws when we work in coalition with diverse leaders and communities across the state on education and policy campaigns. Very important to hear from a lot of different voices, bring a lot of voices together, but also it really helps you not pass policies that are only, helping a slim margin, or at least keep working on those policies. Next slide. So this is just I'm just showing some pictures of how we do that in action. So we're not only using kind of the data that we learn from, what's happening out in the field, but also we really think that our lawmakers and partners hearing from diverse members, diverse people across the state is going to be really important. So we organize virtual advocacy. We organize a few of these a year sometimes. And this last year, we had one with 67 meetings with legislative offices in 1 week, involving over 99 people speaking to their lawmakers about why these policies are important to them. Next slide. And then this is just showing a rally of a really big campaign that on SB 951, which really impacts a lot of people. And we did kind of a year-long campaign and did everything we could to get this important policy passed. Next slide. And then these pictures are just showing, this was a paid sick days rally, just how important it is that you just can't underestimate how important it is for workers to have this time to be there for their family, to care for themselves and care for family members. Next slide. So this is just to show how we've learned and grown as we've gone. So 2002, first paid leave law. 2004, people could take it for the first time. 2013 was the first time that it extended to more family members. Next slide. And then 2016 was our first big increase of wage replacement. 2018, we passed a law that would help more new parents take leave to bond. And then in 2020, a really big leap forward when we extended job protection to 6 million more people and expanded the definition of family as well. And next slide. Then recently, COVID supplemental paid sick leave really showed us how important sick days are to people. 2022, one of our biggest victories and something we're very proud of is permanently increasing the wage replacement through SB 951 to 90% for low wage workers, which will come into effect in 2025 and will make a huge difference. Also in 2023, just this year, we worked with all of our coalition partners, and it was a big fight to expand the number of paid sick days people have, or to increase them. Next slide. The last thing that this year, we also were engaged in strategic planning, so planning for next year and beyond. And we have a fellowship from the Stanford Impact Labs, which will help us, kind of gives us tools and also capacity with this whole cohort to use data to move our work forward. And it's a really good time because we have this data from UCLA World Policy Analysis Center, and we're also learning to collect our own data in an even better way from our members across the state to see where we need to go next. And it's just so important and crucial to have both of those, that type of input. Next slide. And so our next steps on this is to, like Jody mentioned, we're expanding the definition of family and paid family leave to include chosen and extended family. We have a bill this year, AB 518, WICS. And then also just to defend and strengthen our victories through increased education and organizing. In the next webinar, we'll talk about the implementation work, which I'm really glad this whole group sees as just as important as the policy work. Also, removing administrative barriers so people don't have issues when they go to apply. And over the next 3 to 5 years, as Jody touched on, we really need to win policies that include more workers who are left out. And I think that thinking about the minimum hour requirement and the impact on women is a really good thing we need to talk about in the coalition. But there's a lot of groups that, for various reasons of the original design, are left out that we need to bring in. So that's it. And next slide, last slide. So this is how to reach us, workfamilyca.org. And I'm going to hand it back to Karen to lead questions.
Great. Thanks, Jenya, so much. And Jenya and Jody and Marianne, if you all want to come up on video, Jenya, come back and we'll ask some questions. So and please continue to put questions in the Q&A. I've got a couple that I've got teed up, but one that was in the Q&A, which Marianne, I'd love to direct at you, but also Jody and Jenya, if you have thoughts about. Somebody said, I would like for other states to adopt leave for crime victims. What support can be given to our early adopter states to cover those leaves?
I don't know if I'm supposed to answer this, but I have kind of an answer. And I don't know if this is a very satisfying answer, but a lot of times one of the things I've learned, and I've been in this work for 20 years, is that really the more we can have really universal, comprehensive, the less barriers. Because the minute somebody even knows that this law fits that person, that law is for that person, you have to be this person, they already feel like they don't even know if they want to try. But I think we really just need to expand the right to have time off without losing income for a lot of different events in your life without necessarily naming each one as a separate law. Like this law is if this incident happened to you, that law is that. And sometimes with lawmakers, they really like a law that carves out a special group, and that makes sense in a way. But I think what we really need to do is expand. I feel like that could fall under a lot of things in current California law, for example, and maybe other states too. But I think we just need to broaden that people just need to be able to deal with life's events by being able to have time off. I don't know if other people have different point of view on that.
Yeah, I would just add on to that, Jenya. We've seen on the paid sick day side of things more and more laws that are actually paid time off laws where people are able to use it for whatever they need to use it for. Within paid family and medical leave and paid sick days too, we've seen both sets of laws beginning to take into account safe leave as well, and that is traditionally just for domestic violence, for assault, for things that are more happening in the home. But that doesn't mean that it couldn't be expanded in other ways. So I would say for early adopters who are interested in it, to look into what it would really, what kind of language it would take immediately, to think about what amount of time would be appropriate in those cases. I have a colleague on staff at Family Values at Work who's actually very interested in this, who's beginning to do a little bit of research on it. So I'd also encourage you just to reach out to us, and maybe we can talk one-on-one, or I can connect you to him to discuss it further.
Great, thank you. One question I had while we're waiting for hopefully some more questions to get thrown into the Q&A is, we've talked a lot about data and research and the value it can bring, and I'm wondering, sort of a flip side of that is the value of stories and storytelling. And where does storytelling sit? Sort of how do you use it together with the data when you're trying to make change? So happy to have any of you answer that.
Well, while Jenny and Marianne are thinking and chiming in, I do want to say that data can also tell stories. So I do think the individual stories are invaluable, but I'll just mention how the global data tells a story again. So 20 years ago, we started saying the list of countries that didn't have paid maternity leave. It was about 20 long, but that list got picked up around the world. And one by one, we would get countries writing us, don't name us already with the United States. We're not as big a laggard as the US. That's because there was a story there just in the data. So I think that's important. And it's crucial that we talk about people's lived experiences, because the data alone, I think either alone isn't enough. It's not enough just to say, here are the numbers, it's unaffordable to, without describing what's that mean for someone's life. Do they lose their house? Can they not pay their rent? What's unaffordability look like? But likewise, telling one story without convincing people that this is happening to 2/3 of Americans isn't enough.
Yeah. No, I agree. And I think I do feel like being a coalition, having a lot of members that are directly impacted. So they're active on the issue, but they're also directly impacted. And that's really important to us, that we're not separating out the storyteller from the activist, because why are they not? They are the same person a lot of the time, to the extent they have time. But I think stories have really, it just is very moving, especially for lawmakers and even for us internally. It just helps kind of make it more real than just the numbers sometimes. And I also see stories as data. A lot of our, one of the things we've learned through the data collection cohort we're in now is that we have on staff, some of my staff are organizers in their background. And so what they're used to is the one-on-one meeting that you have as an organizer. And you are learning about how this issue impacts that person, how it impacts the community they belong to. And I do think it's been really important. And stories really shaped our work on SB 951, which expands wage replacement, because we met a member of Parent Voices, which is a group in the coalition, who couldn't, went to take leave to bond with his new child, and then had to go back to work when he got his first check. It just wasn't enough. And he really felt like he missed out on that time, and became an activist on this issue, and has shared his story so many times, but also has really driven a lot of the activism and work on it. And hopefully it changes the culture, because I really think we need that if we want to have that comprehensive time off. There just has to be a cultural shift where this is the norm. We're all human beings. We all need time off for various reasons.
I just want to add one more piece because we're so grateful to Blue Shield for having made this possible. And that's around numbers and structural inequalities, structural racism, structural inequalities across gender and class. There are a lot of people who experience them, who live them, who know them, and there are a whole lot of people who don't even believe they exist. And I think two things that the numbers can do are, one, demonstrate that they exist and help people understand how these policies that seem neutral, how many people your employer has, how many hours you've worked, aren't neutral, how they do structure inequity.
Marianne, anything you want to add on that?
I think that Jenya and Jody have both said just about everything I would say. The one other piece I would add, in addition to making sure that always people who are impacted by these laws are in there with legislators making decisions about them, is to remember too that every one of us has our own story on caregiving. I challenge anyone to find a person who has not needed paid leave or known someone who has. And the importance of just remembering your own story and how this would affect you is incredible.
Marianne, that's just making me think, and I don't exactly know where my question is, but that many legislators themselves likely have taken or wanted to take or live in states where they, don't have access to paid leave, and kind of how to use legislators themselves to tell their own stories. And Jenya, I think we've seen that a little bit. I don't know if you want to share kind of where you've seen legislators kind of telling their own stories.
Yeah, we've especially recently, one of the really big popular bills that we're working on is 518. So many people have stories of caring for a family member not by blood. But I think we're starting to even track legislators who have shared these stories, the ones that where we know a little bit of their background, because it's very interesting. Like, we've had legislators that are really even on social media sharing about being a caregiver, which is, I think, so nice. And both Family Days at Work and the coalition and a lot of our partners are involved in this kind of cultural change of really kind of sharing that part of yourself just being a human being that needs care and gives care. And I really like that. And I think that's a good point about legislators and their own stories.
So we've got just 2 minutes left for questions. I think the last question I want to ask is really, Jody, you've done all this great research, and I know that you've done it along the way in partnership with Family Values at Work. And I'm wondering if you can talk very briefly in just a minute or two about kind of the value of academic research that is done in partnership with advocates.
Yeah, I would totally love to, because we're so grateful for the partnership. And absolutely, this doesn't happen often enough. So academics are taught they can't partner, as if learning from advocates or making our work relevant to advocates is a problem, as opposed to it's the solution. it's the success story to make sure that there's uptake on important issues, and that we learn from all that lived experience and what the crucial issues are. So quickly, I think what works so well, and then I want to make sure to pass it to Marianne and hear from her and from Jenya about it. But what I would say is, in the beginning, we went and said, are we measuring the right things? I think that's really important to ask. Are we looking at the right questions? Which questions did we miss? Leading into the implementation, one of the things we heard was measure how hard it is to access. And we have extra data looking at that. How many languages, how many different state portals. And then during the process, feed it back to people working on the ground. Did we get it right? Did we get it wrong? Does this make sense? I think all that back and forth, and I could talk much longer about it, but I know we're running out of time, is crucial to making the work rigorous. Having an academic helps with that, showing you're separately, objectively looking, but deepening it with the learning. And I'll pass it to Marianne and Jenya.
I will just say quickly that being able to work with Jody and Allison, the entire World Policy Analysis Center, gave us a real opportunity to make sure that the data would be relevant to the needs that we see. Not that we were influencing the data, but just that we were going to be able to answer questions that we get all the time. And our entire network of 27 states and coalitions participated in collecting the data and checking the data and talking about what we wanted to find, what would be helpful. So it really was a very large group effort that I'm really proud of, and so glad to have been able to work on it.
Thank you. So we are out of time. So I just want to do a really quick closing by starting by thanking Marianne, Jody, and Jenya for your time. I also want to thank the Center for Collaborative Planning, who have been working behind the scenes to help us coordinate this. Please join our next webinar, which is in 2 weeks, which is going to focus on implementation. We'll have California Work and Family Coalition back, as long as some staff from the New Jersey Department of Labor and Workforce Development, talking about the innovative work they've been doing to improve access to their paid leave program. A link to the registration just for that webinar just went into the chat, so please sign up for that. We will be sending follow-up information, including slides from today, and please get in touch with us for any more information. I know there was one question in the Q&A that we didn't get to, so please reach out to any of us for more information. And thank you so much, and have a wonderful afternoon. We appreciate you all being here today.
Thank you so much again for joining us and for hosting this.
Thank you all. Ending the webinar.